Do you take vitamins or supplements on top of your medications? Then stay with me, because this might literally save your life. 1 in 4 older adults takes more than 5 medications a day, and the alarming part is that 70% never tell their doctor what supplements they're using, and that's where the danger begins. Many people think it's natural so it can't hurt, but every year thousands end up in emergency because they mix supplements with medications. So today I'm going to show you 7 dangerous combinations that can cause anything from brain bleeds to permanent nerve damage. Subscribe now so you don't miss any practical, science-based health videos. Ready? Let's begin. Vitamin K plus blood thinners. Imagine your blood has brakes and accelerators. Anticoagulants, like warfarin, are the brakes. They prevent dangerous clots. Vitamin K is the accelerator. It helps form clots. So what happens if you take both? They cancel each other out. If you suddenly take more vitamin K, your brakes stop working, and you can form a clot that blocks an artery in the brain or lungs. The problem isn't eating spinach or broccoli. The problem is being inconsistent. One day you drink a green smoothie, and the next day nothing. That irregularity throws everything off. Tip: if you take blood thinners, keep your vitamin K intake stable, and always tell your doctor before starting new supplements. And don't worry, if you use modern anticoagulants like apixaban or rivaroxaban, the risk is much lower. Ginkgo biloba plus blood thinners or aspirin. You've probably heard of Ginkgo biloba, the plant that's supposed to improve memory and circulation. But be careful. A study with more than 11,000 patients found that people taking Ginkgo with warfarin had 38% higher risk of serious bleeding. Ginkgo boosts the anticoagulant effect, like having 2 sets of brakes at once. That can cause bruising, internal bleeding, or even brain hemorrhages. So if you take aspirin, ibuprofen, or any anticoagulant, skip the Ginkgo. Natural does not mean harmless. Vitamin D plus Digoxin digitalis. Vitamin D helps you absorb calcium. But if you take heart medications like Digoxin, that combo can be dangerous. Why? Because too much vitamin D raises calcium levels, making the heart more sensitive to digoxin. Result: arrhythmias, confusion, nausea, and in severe cases, cardiac arrest. This is common because many older adults have low vitamin D and take supplements without monitoring. Tip: if you take digoxin, your doctor should check your calcium levels every 3 months. And remember, more vitamin D is not better. Too much zinc equals copper deficiency. During the pandemic, many people started taking zinc to boost immunity. But more than 50 milligrams a day can cause a severe copper deficiency. Without copper, your nervous system starts to fail. Tingling, leg weakness, difficulty walking. In many cases, the damage is permanent. A recent study found that 62% of people taking excess zinc developed low copper levels. Tip: don't take more than 40 to 50 milligrams of zinc daily without medical supervision. If you take it for months, get your copper levels checked every 3 months. If you notice numbness or balance issues, stop the zinc and talk to your doctor. Metformin plus vitamin B12. This combo isn't intentional, but it is dangerous. Metformin, the most common medication for type 2 diabetes, reduces B12 absorption over time. Result? Your body runs out of a vitamin essential for nerve health. And when symptoms appear, tingling, weakness, numbness in the feet and hands, the damage may already be advanced. Between 5% and 50% of people on metformin have B12 deficiency, especially after years of use. Tip: if you've been taking metformin for more than 4 years, ask your doctor for an annual B12 test. If it's low, the fix is simple: oral supplements or injections, and you can prevent permanent nerve damage. Vitamin D plus calcium. This combination seems harmless, right? It's supposed to strengthen your bones, but too much can do the opposite, causing kidney and vascular problems. Vitamin D increases calcium absorption, And if you take both supplements together, calcium can build up in your blood. This is called hypercalcemia, leading to fatigue, nausea, confusion, and in severe cases, kidney stones. Tip: if you take vitamin D and calcium, check your calcium levels every 3 months. And drink at least 2 liters of water a day, unless your doctor says otherwise, to help your kidneys eliminate the excess calcium. If you're finding this helpful so far, make sure to subscribe, because what comes next is even more surprising. Iron plus levothyroxine, thyroid medication. This is one of the most common and least known on interactions. Millions of people take levothyroxine for hypothyroidism and iron supplements for anemia, but iron blocks the absorption of levothyroxine and the treatment stops working. Your thyroid shuts down again, leaving you tired, cold, and unmotivated. The fix is super simple. Leave at least 4 hours between levothyroxine and iron. For example, take levothyroxine on an empty stomach and iron before bed. That way they don't interfere with each other. Warning signs: watch out for 3 symptoms you should never ignore if you take supplements and medications. 1. Abnormal bleeding, large bruises, blood in urine, or bleeding gums for no reason. 2. Neurological symptoms: tingling, numbness, or difficulty walking. 3. Extreme fatigue, nausea, or excessive thirst. Possible signs of high calcium or kidney problems. If you notice any of these, see a doctor as soon as possible. Most interactions can be fixed by adjusting doses or spacing out supplements. What to do starting today? 1. Make a list of everything you take: medications, vitamins, herbs, teas, everything. 2. Bring it to your next appointment. Show it to your doctor or pharmacist and ask, is there anything here that could interact? 3. If you take blood thinners, metformin, or thyroid medication, you need regular checkups. Don't wait for symptoms. Remember, most dangerous interactions don't kill suddenly. They damage little by little, and you can prevent them with information and monitoring. Your health doesn't depend only on what your doctor prescribes. It also depends on what you decide to take on your own. Now you know the 7 most dangerous combinations between vitamins and medications. Share this with someone who might need it. You could save a life. And before you go, subscribe and turn on the bell, so you don't miss future videos on how to take care of your health with science, not fear. See you in the next video.